Compare and contrast quantitative and qualitative research designs in nursing education. Discuss their strengths and limitations in evaluating teaching effectiveness. Answer: quantitative research design. This involves structured, objective data collection, often using tools such as surveys or tests. It is best suited for studying relationships, causation, and measurable outcomes. Strengths: provides generalizable data when sample size is adequate, useful for identifying trends and making predictions. Standardized instruments ensure reliability and validity. Limitations: may overlook nuanced contextual aspects of teaching effectiveness, requires rigorous design to avoid biases, e.g. selection bias. Qualitative research design. This approach focuses on exploring phenomena through open-ended questions, interviews, or focus groups aiming to understand experiences and perceptions. Strengths: captures rich, detailed descriptions of experiences, suitable for exploring new or complex phenomena, provides context-sensitive insights. Limitations: results are not generalizable due to small sample sizes. Subjectivity may introduce researcher bias. Integration in nursing education. Mixed method designs combine the strengths of both approaches, offering a comprehensive evaluation of teaching effectiveness. Relevant guideline. The National League for Nursing, NLN, emphasizes a mix of methodologies for robust evaluation in nursing education research. Dr. Amy, a nursing educator, introduces a new simulation-based teaching module to improve students' clinical decision-making skills. Early assessments show mixed results, with some students excelling while others struggle. How should Dr. Amy approach this situation using translational research principles? Answer: Dr. Amy should identify the gap, review existing evidence to determine whether simulation-based modules have been shown to enhance decision-making skills, adapt evidence, customize the module to address student diversity, e.g. cognitive styles, prior knowledge, evaluate implementation, use planned use study at PDSA ACLs to assess the module's effectiveness and iteratively refine it, engage stakeholders, collaborate with students, faculty, and clinical staff to identify barriers to learning, measure outcomes, collect both quantitative data, test scores, and qualitative feedback, student perceptions. Relevant guideline. The NLN's transformational leadership model advocates iterative refinement of educational interventions based on stakeholder feedback and outcome evaluation. Why is triangulation critical in nursing education research? Illustrate with an example. Answer: triangulation. The use of multiple data sources, methods, or researchers to validate findings, ensuring robustness and reliability. Importance: reduces bias by corroborating evidence, captures a holistic view of the phenomenon, strengthens confidence in results. Example: in a study evaluating student engagement during clinical simulations, triangulation might involve observations of student interactions, student surveys about their learning experiences, performance metrics, e.g. simulation scores. When all methods point to consistent findings, confidence in the results increases. Relevant guideline. The NLN research priorities emphasize the need for methodological rigor, including triangulation, to ensure credible outcomes. What are the key components of evidence-based teaching in nursing education, and how do they enhance learning outcomes? Answer: key components: use of research evidence, integrating findings from educational and clinical studies, learner-centered approaches, tailoring methods to individual needs, e.g. active learning strategies, continuous assessment, using formative and summative assessments to guide teaching adjustments, faculty development, training educators in evidence-based methods, enhancements to learning outcomes, promotes critical thinking and problem solving, aligns teaching methods with student learning styles, ensures teaching practices are aligned with current best practices in clinical settings. Relevant guideline. The Institute of Medicine's Future of Nursing report highlights the role of evidence-based teaching in preparing competent nursing professionals. Mr. Harris, a senior faculty member, has been assigned to mentor a novice nurse educator, Ms. Lee, who struggles with classroom management. What strategies should Mr. Harris use to effectively mentor Ms. Lee? Answer: key strategies include set clear goals, collaboratively establish objectives such as enhancing classroom engagement, provide resources, share tools and techniques for managing disruptive behaviors, model best practices, invite MS, lead to observers' classes, offer constructive feedback, focus on strengths while addressing improvement areas, encourage reflection, help MS reanalyze her teaching methods and outcomes. Relevant guideline. According to the NLN's mentorship guidelines, effective mentoring includes goal setting, regular feedback, and fostering self-efficacy in mentees. Explain the role of SWOT analysis in strategic planning for nursing education programs. Answer: SWOT analysis identifies strengths, weaknesses, opportunities, and threats in the program's internal and external environment. Strengths: internal capabilities, e.g. experienced faculty; weaknesses: areas for improvement, e.g. outdated facilities; opportunities: external factors to leverage, e.g. grants; threats: external challenges, e.g. reduced enrollment; impact: aligns resources with priorities, identifies areas for development, informs decision-making for program growth. Relevant guideline: the American Association of Colleges of Nursing often recommends strategic planning to align nursing programs with evolving healthcare needs. Explain how the principles of adult learning theory, andragogy, can be applied to create effective simulations for nursing students. Answer: andragogy, as proposed by Malcolm Knowles, emphasizes that adult learners are self-directed, bring prior experience to their learning, are problem-centered, and are motivated by real-world relevance. In designing simulations for nursing students, self-direction allow learners to take the lead in simulations by presenting scenarios where they must make clinical decisions, fostering autonomy. Use of prior experience: incorporate cases that connect to learners' previous clinical experiences, allowing them to apply and expand on their knowledge. Relevance to practice: ensure scenarios mimic real-world challenges, such as managing a patient with acute respiratory distress, making learning practical and engaging. Problem-centered learning: focus simulations on solving complex clinical problems, such as prioritizing care for multiple patients. Immediate application: debrief after the simulation to link experiences to evidence-based practice, reinforcing the learning objectives. Incorporating these principles ensures simulations not only enhance technical skills, but also foster critical thinking and decision-making abilities essential for clinical practice. Compare and contrast the ADDIE and ASSURE instructional design models in the context of developing a nursing education course. Answer: both ADDIE, analyze, design, develop, implement, evaluate, and ASSURE, analyze learners, state objectives, select media, utilize media, require learner participation, evaluate, and revise, are systematic frameworks for an instructional design. Here's a comparison. Focus: ADDIE provides a broad structure applicable to any instructional setting, focusing on iterative improvement. ASSURE is tailored to integrating technology and media into learning stages. ADDIE emphasizes creating and refining course elements through 5 distinct phases. ASSURE breaks down each phase into actionable steps, especially emphasizing technology use, application in nursing education. Use ADDIE for overarching course design, such as developing a semester-long course on pharmacology. Use ASSURE for designing technology-driven lessons like integrating virtual reality (VR) for practicing intravenous insertion. Dr. Thompson is tasked with teaching a culturally diverse cohort of nursing students. Some students express discomfort with case studies that focus solely on Western healthcare models. What steps should Dr. Thompson take to address this concern while ensuring effective learning? Answer: Dr. Thompson should adopt a culturally competent approach to education by incorporating multicultural content, include case studies from various cultural perspectives, such as traditional healing practices and their integration with Western medicine, engaging students, facilitate discussions where students can share insights about healthcare practices from their cultures, tailoring learning objectives, ensure learning outcomes respect cultural diversity, such as teaching culturally sensitive communication, providing resources, offer materials that discuss global health perspectives, encouraging a broader understanding of patient care, evaluation, and feedback. Gather feedback from students to continually refine the approach and ensure inclusivity. Relevant guidelines. The National League for Nursing, NLN, emphasizes cultural competence as a core component of nursing education, promoting equity and inclusion in teaching strategies. Explain how flipped classroom techniques enhance learner-centered teaching in nursing education. Answer: flipped classroom techniques shift content delivery outside of class, e.g. through recorded lectures, and focus classroom time on active learning activities. Benefits include active engagement. Classroom sessions are used for problem-solving, discussions, and case studies, engaging students actively. Individualized learning. Students learn theoretical content at their own pace, allowing for differentiation. critical thinking development, in-class activities such as analyzing clinical scenarios, foster critical thinking skills essential for nursing, immediate application, enables students to apply concepts such as pathophysiology to practical patient care situations in real-time discussions. Flipped classrooms align with learner-centered approaches by prioritizing student engagement and practical application over passive lecture-based methods. Discuss how virtual reality, VR, can address challenges in clinical teaching strategies for nursing students. Answer: virtual reality, VR, offers immersive learning experiences that can overcome several challenges in clinical teaching. Access to rare cases. VR provides simulated experiences for conditions rarely encountered during clinical rotations, e.g., pediatric emergencies, safe environment. Students can practice invasive procedures like catheter insertion without risking patient safety. Standardization. All students experience the same scenarios, ensuring consistent learning opportunities. Engagement and retention. VR engages learners actively, enhancing retention through experiential learning. Relevant guidelines. The American Association of Colleges of Nursing often supports innovative teaching strategies, including VR, to bridge the gap between theoretical knowledge and clinical skills. Describe the relationship between active learning strategies and competency-based education (CBE) in nursing education. Answer: active learning strategies such as group discussions and problem-based learning are integral to competency-based education (SPE). Focus on skills. Active learning ensures students practice and demonstrate core competencies such as patient assessment. Assessment alignment. CBE evaluates learners based on their ability to perform tasks. Active learning provides practice opportunities. Engagement. Strategies like simulations keep learners engaged, ensuring they master competencies effectively. CBE ensures learning outcomes are tied to practical skills, while active learning provides the methodology to achieve those outcomes. Nurse Educator MS. Patel notices her students struggling with pharmacology concepts during group discussions. She plans to integrate problem-based learning (PBL). What steps should MS Patel take to ensure effective implementation of PBL? Answer: MS Patel should follow these steps: identify problems, select real-world pharmacology cases, such as managing polypharmacy in elderly patients, facilitate group work, divide students into small groups to analyze the problem, fostering collaboration, provide guidance, and act as a facilitator to ensure discussions remain focused while allowing self-directed learning, promote reflection. After solving the case, encourage students to reflect on their learning process and outcomes. Relevant guidelines. PBL aligns with the NLN competencies for nurse educators, emphasizing critical thinking and self-directed learning as key educational goals. Discuss how constructivist learning theory influences the principles of curriculum design in nursing education. Provide examples to illustrate your answer. Answer: constructivist learning theory posits that learners construct their own understanding and knowledge of the world through experiences and reflection. In curriculum design for nursing education, his theory emphasizes active learning, collaboration, and problem-solving. Influence on curriculum design. Student-centered learning. The curriculum shifts from instructor-centered to learner-centered approaches. For example, students are encouraged to explore case studies or engage in group projects. Integration of real-world scenarios. Courses incorporate clinical simulations and problem-based learning (PBL) to mirror real-life nursing challenges. Reflection. Reflective journals and debriefing sessions are integrated into the curriculum to help students analyze their experiences. Example: in a course on patient safety, students might work collaboratively to identify safety risks in a simulated hospital setting, propose solutions, and reflect on their learning during a post-simulation discussion. Why is blueprinting critical in developing valid and reliable nursing assessments? Answer: blueprinting is a systematic process of mapping out the content and cognitive levels to be assessed in an exam. Criticality. Content validity. Ensures the test aligns with the curriculum and covers all necessary content areas. Cognitive balance. Promotes a balance of lower-order and higher-order cognitive skills based on Bloom's taxonomy. Fair assessment. Prevents overrepresentation of some topics and underrepresentation of others. Example: for a pharmacology test, a blueprint might allocate 30% of questions to drug classifications, knowledge level, 50% to clinical applications, application level, 20% to error prevention strategies, analysis level. Dr. Martinez is developing a competency-based curriculum for a new nursing program. She wants to ensure the curriculum meets both clinical and theoretical learning goals. What steps should Dr. Martinez take to achieve this balance, and how should competencies be defined and assessed? Answer: steps to achieve balance: define competencies, identify essential knowledge, skills, and attitudes required for nursing practice. These should align with national standards like the QSEN competencies or AACN essentials. Integrate theory and practice. Design courses that combine theoretical instruction, e.g., classroom lectures on pathophysiology with practical application, e.g., simulation labs or clinical rotations. Use evidence-based frameworks. Apply frameworks such as Beners-Navis to expert model to guide competency progression. Assessment strategies. Develop rubrics for clinical performance evaluations. Incorporate objective structured clinical examinations (OS) for real-time assessment. Use formative assessments like reflective essays and debriefing sessions. Relevant standards. The Commission on Collegiate Nursing Education (CCE) mandates that competencies be clearly defined, measurable, and aligned with program outcomes. Critique the use of standardized testing as a benchmark for program success in nursing education. Answer: advantages. Objective measurement provides a standardized metric to evaluate student learning outcomes. Accreditation requirements aligns with accrediting bodies' expectations, e.g., NCLE pass rates as a program success indicator. Diagnostic tool identifies areas where students may need remediation. Challenges: teaching to the test may narrow the curriculum to focus on testable content at the expense of broader competencies. Equity concerns favor students with test-taking skills, potentially disadvantaging others. Limited scope fails to assess critical skills like clinical judgment comprehensively. Conclusion: while standardized testing is a useful tool, it should be complemented by other assessments such as OSs, simulations, and portfolio reviews. Explain how item analysis can be used to improve the quality of nursing exams. Answer: item analysis evaluates the performance of individual test questions to determine their effectiveness. Components of item analysis: difficulty index measures the percentage of students who answer the question correctly, ideal range 3.70%. Discrimination index determines how well an item differentiates between high-performing and low-performing students, ideal range 0.30. Distractor analysis assesses the functionality of incorrect options. Poorly functioning distractors should be revised or removed. Application: after analyzing an exam, instructors might revise ambiguous questions or remove items with low discrimination indices to ensure fairness and reliability. Relevant standards: the AERA standards for educational and psychological testing recommend item analysis as part of test evaluation procedures. Emily, a nursing student, performs poorly in a simulation-based evaluation. She failed to identify a critical patient safety issue but demonstrated strong interpersonal skills with the simulated patient. How should her instructor address this in both feedback and remediation planning? Answer: feedback. Provide balanced feedback highlighting strengths, interpersonal skills, and areas for improvement. Critical thinking in safety. Use SBAR, situation, background, assessment, recommendation, to structure feedback, remediation plan. Assign Emily to review case studies focusing on patient safety. Schedule additional simulation sessions emphasizing critical safety protocols. Pair Emily with a peer mentor for collaborative learning. Guidelines: the NLN simulation guidelines emphasize structured debriefing and targeted remediation as critical steps to improving clinical competencies. How can continuous quality improvement (CQI) be implemented in a nursing program to enhance curriculum effectiveness? Answer: implementation steps. Collect data. Use student evaluations, NCLE, pass rates, and faculty feedback to identify gaps. Analyze trends. Evaluate patterns in assessment data, e.g., consistent underperformance in pharmacology. Develop action plans. Create targeted interventions such as revising course materials or introducing new teaching strategies. Monitor outcomes, reassess performance metrics post-implementation. Framework: apply the Planned Use Study Act PDSS cycle for iterative improvements. Relevant standards: accrediting bodies like the ACE and require evidence of CQI processes in maintaining program accreditation. What are the benefits of curriculum mapping in ensuring alignment with program outcomes? Answer: benefits. Alignment ensures courses and assessments are aligned with program learning outcomes. Gap identification highlights areas where outcomes are not adequately addressed. Integration promotes horizontal and vertical integration of content across the curriculum. Example, a curriculum map might reveal that ethical decision-making is covered in multiple courses but lacks depth. Faculty could then enhance related assignments or simulations. Standards, the AACN Essentials emphasize the importance of curriculum alignment to meet competency expectations. What are the key elements of a high-quality simulation-based evaluation in nursing education? Answer: key elements. Clear objectives. Define specific skills to be assessed, e.g., communication, critical thinking, realism. Use high-fidelity simulators and realistic scenarios. Standardized assessment tools. Employ validated rubrics to ensure consistency. Structured debriefing. Facilitate reflective discussions post-simulation. Guidelines. The International Nursing Association for Clinical Simulation and Learning and NACSL standards provide a framework for effective simulation practices. How do accreditation standards, such as those set by the Commission on Collegiate Nursing Education (CCNE), influence the design and implementation of nursing education programs? Answer: influence on program design. Accreditation standards provide a framework for ensuring nursing programs meet essential educational, clinical, and ethical benchmarks. These standards impact program objectives, student outcomes, curriculum design, faculty qualifications, and student services. Curriculum alignment. Accreditation ensures that the curriculum addresses key areas like patient safety, ethics, and evidence-based practice. Continuous improvement. Programs are required to engage in ongoing self-evaluation and improvement, responding to trends in healthcare technology and educational methodologies. Assessment requirements. Standards mandate the use of comprehensive assessments, e.g., NCLE, pass rates to measure program effectiveness and student success. Example: a nursing program seeking CCNE accreditation must show alignment between its learning outcomes and the QSE-N competencies and demonstrate how the curriculum integrates these competencies throughout the program. Explain how cultural competence in education enhances the learning experience for nursing students. Answer: cultural competence improves nursing education by fostering inclusivity, recognizes and values diverse perspectives, making all students feel respected, enhancing patient care, prepares students to provide culturally sensitive care to patients from varied backgrounds, encouraging critical thinking, promotes exploration of how cultural beliefs impact healthcare decisions, relevant guidelines, the national standards for culturally and linguistically appropriate services, clause, highlight the importance of embedding cultural competence in healthcare education. Discuss how transformative learning theory can be applied in nursing education to facilitate deep learning and personal growth in students. Answer: transformative learning theory, developed by Jack Meziero, focuses on changing students' perspectives through critical reflection and experiential learning. In nursing education, transformative learning can be applied as follows. Critical reflection. Encourage students to reflect on their clinical experiences and examine their assumptions about nursing practice. For example, after caring for a critically ill patient, students can discuss how their emotional reactions influence their professional behavior. Disorienting dilemma. Introduce real-world challenges, such as ethical dilemmas or complex patient care, that force students to question existing beliefs and approaches. Dialogue and collaboration. Promote group discussions and peer feedback to allow students to express diverse views, thus broadening their understanding of nursing practice. Change in perspective. Through reflective journaling or mentorship programs, students develop a deeper understanding of themselves and their roles as nurses, leading to more effective clinical practice. Explain the concept of competency-based education (CBE) in nursing and its advantages over traditional education models. Answer: competency-based education (CBE) focuses on students demonstrating mastery of specific skills and competencies rather than spending a fixed amount of time on course content. In nursing, CBE includes clear learning outcomes. Nursing programs define specific competencies, e.g., patient assessment, medication administration, that students must master before progressing. Flexible learning pace. Students can progress through the program based on their ability to demonstrate competence rather than time spent in class, making education more personalized. Assessment-driven. Assessments are aligned with competencies and students are evaluated through practical exams, simulations, or clinical evaluations, ensuring mastery before moving forward. Real-world application. Competencies focus on skills that students will directly apply in clinical settings, ensuring relevance to practice. Advantages. Increased student success. Students progress at their own pace, improving retention and skill acquisition. Personalized learning. Students can revisit and master areas where they are less proficient. Workforce readiness. Graduates are highly competent and ready for real-world nursing practice. Relevant guidelines. The National League for Nursing (NLN) supports CBE as an approach that ensures nursing education is both rigorous and aligned with industry demands. MS. Clark is teaching a clinical skills lab on wound care. Some students are struggling with the hands-on skills and feel overwhelmed by the complexity of the procedures. How should MS. Clark modify her teaching strategies to better support these students? Answer. MS. Clark should implement the following strategies: provide clear, step-by-step demonstrations, break the procedure into manageable steps and model the wound care process multiple times. Visual aids, such as diagrams or videos, can reinforce the learning process. Scaffold learning. Begin with simpler tasks like cleaning a wound and progressively introduce more complex steps, such as suturing, once students gain confidence. Encourage peer support. Pair struggling students with more experienced peers for hands-on practice, fostering a supportive learning environment. Offer reflective practice. Encourage students to reflect on their skills after practice and provide constructive feedback to enhance their performance. Create a low-stakes environment. Foster a non-judgmental atmosphere where students can practice without fear of failure, promoting confidence and mastery. Relevant guidelines. According to the National Council of State Boards of Nursing (SEN), hands-on practice and formative feedback are essential to mastering clinical competencies in nursing. Discuss Kotter's 8-step model of change management and its application in nursing education. Answer. Kotter's model. Create urgency. Build a guiding coalition. Develop a vision and strategy. Communicate the vision. Empower action. Generate short-term wins. Consolidate gains. Anchor changes. Application in nursing education. When introducing a competency-based curriculum, leaders can use the model to communicate the need for change due to shifting clinical demands. Build faculty support for the curriculum. Celebrate early successes, e.g. improved student outcomes. Relevant guideline. The NLN encourages structured change models to ensure seamless transitions in curriculum redesign. What are the key components of evidence-based teaching strategies, and how can these strategies be implemented to improve student retention in nursing programs? Answer. Key components of evidence-based teaching: best available evidence, integrating the latest research on teaching methods and learning outcomes, student-centered approach, tailoring instruction to meet diverse learning needs and preferences, e.g. active learning, collaborative learning, continuous assessment, using formative assessments to adjust teaching strategies throughout the course, reflective practice, engaging faculty in continual self-evaluation and development, implementation to improve retention, incorporating active learning strategies such as problem-based learning, PBL, and simulation to engage students, regularly assessing student progress and providing targeted interventions for struggling students, fostering a supportive learning environment with mentorship and peer support systems. Discuss how servant leadership can be applied to the nursing education environment and what benefits it may offer compared to other leadership styles. Answer. Servant leadership in nursing education. Core principle: the leader's primary role is to serve others, emphasizing the development of staff and students rather than focusing on personal power. Application: nursing educators who practice servant leadership prioritize faculty development, student success in a collaborative, supportive environment. They engage in active listening, empathy, and mentoring, fostering an environment of trust and mutual respect. Benefits compared to other leadership styles: transformational leadership. Servant leadership is often more focused on the holistic development of individuals rather than just achieving organizational goals. Transactional leadership. Unlike transactional leadership, which is primarily focused on reward and punishment for task completion, servant leadership creates a nurturing environment that promotes long-term engagement and loyalty.